Okay, welcome everyone. We are going to go ahead and get started. So good morning and thank you for joining us. We are definitely happy you're with us today. We have some great information to go over with you today. It's our September Age Well series presentation. My name is Jill Rankin. I am the Executive Director for the Wisconsin Institute for Healthy Aging, bringing this series to you today. We are a nonprofit organization whose mission is to provide evidence-based healthy aging resources and programs to communities throughout the state of Wisconsin. We partner with over 100 different amazing organizations throughout the state who implement beneficial healthy aging programs in our local communities. So thank you to all of you. And we're really excited for today's presentation, Age with Confidence at Home, because as we enter September and kick off Fall Prevention Awareness Month here in Wisconsin, we want to highlight this important and valuable information because while falls are common, they are not a normal part of aging. And today you're going to learn some things that we can do to decrease our risk and prevent falls. So I'm honored to hand over a welcome from our wonderful sponsor for this event. We have TMG and Molina Cares with us today. So Dan, would you like to say a few words?
Sure. Thank you, Jill. Good morning, everybody. It's a pleasure to be here. Like Jill mentioned, my name is Dan Crone, and I am with TMG. TMG is an agency in Wisconsin's IRIS program. If you're not familiar with the program IRIS is one of Wisconsin's long-term care options. It's considered the self-directed long-term care option in Wisconsin. The program is unique because it gives individuals full control over the funding they receive for the services and supports they need. The whole philosophy of the program is how do we help people get lined up with the services and supports they need in order to remain living in their home or their home of their choosing, be active in their communities, get connected with others, and get the health and safety supports that they need. I will put some additional information into the chat around our organization. I'll also put a link to our website and my personal contact information should anyone want to get any additional information. But we're happy to be here today and we're happy to be sponsoring this wonderful event. So thank you.
Thanks, Dan.
All right, well, I'm going to take over now. Thank you, Jill. I'm Suzanne Riley, Promotion Program Coordinator with the Wisconsin Institute for Healthy Aging. I'm excited to welcome our speaker for today, but first, just a few housekeeping pieces. Please remain muted if you're able to, and you can have your camera on or off during the presentation. This webinar will be recorded, and an email will be sent out to all of the people who registered after the presentation. If you have any questions, please use the chat box, and we will have some time for questions and answers at the end of Dr. Field's presentation. Now I'm happy to introduce Dr. Beth Fields, occupational therapist, and Beth is going to talk a little bit about home safety for falls prevention. So I'm going to stop sharing my screen and allow Beth to share your screen.
Sounds good. Can everyone hear me and see the slides?
Yes, you can.
Okay, perfect. Well, welcome everyone. I'm so happy to be here today to talk more about home safety to help you prevent falls. So as Suzanne mentioned, I'm an occupational therapist. Before moving into the academic space, I worked in home healthcare and did a ton of home safety assessments. And now, being in the occupational therapy program at the University of Wisconsin-Madison, I partner with some nonprofit organizations to deliver home safety assessments with our clinical doctoral occupational therapy students as well. So let's go ahead and get started. So some learning objectives for the webinar today. By the end of my presentation, you'll be able to identify some contextual and environmental factors to help you age in place successfully. You'll be able to apply some strategies to prevent falls and locate available resources to support aging in place. So what is aging in place? Aging in place is defined by the CDC as the ability to live in your home and community safely, independently, and comfortably, regardless of your age, income, or ability level. However, only 10% of American homes are aging ready. And this is a report that the U.S. Census Bureau collected in 2020. As homeowners age, they are at an increased risk of falling. A 2017 report found that 41% of people tripped or fell, resulting in an injury. But the good news is, falls are not a normal part of aging, and you can do a number of things to lower your risk of experiencing one. And according to the CDC, the Center for Disease Control and Prevention, falls among adults aged 65 and older caused over 34,000 deaths in 2019, making it the leading cause of injury for that group. And in 2019, the emergency department recorded over 3 million visits for older adult-related falls. So how can we improve and prevent falls? Improve our home environment and prevent falls. An enabling environment is one in which a person can lead as full and independent life as possible. So successful aging in place depends upon an enabling environment. And we know that as people age, they're likely to experience memory loss, perception changes like vision and hearing, have poor concentration, as well as experience changes in balance and strength. It's thus important that we really take into consideration simple modifications using key design principles to create an enabling environment. So I know many of you have your videos off, but for those of you that have your videos on, or those that can use the chat, by a show of hands, how many of you have had someone come in to complete a home safety assessment? Again, you can use the chat too if you don't have video option. Just write yes if you've received one or no if you haven't. So I'm seeing a lot of no's, some yeses. So standard healthcare, to get most home safety assessments, you would have had to have experienced some type of injury or condition to have a doctor write an order for an occupational therapist, for example, to come out and do a home safety assessment, usually as part of a home health order. So if you've had home health in the past, maybe an occupational or even a physical therapist or social worker has come in and recommended changes to your home environment. There are some nonprofit organizations and other resources to access home safety assessments that I'll share at the end of the presentation today, where you can get a home safety assessment as more of a preventative measure to be more proactive to help you age in place versus reactive, which is typical for home safety assessments in our current healthcare system. So now I'm going to just walk through different spaces within the home environment and highlight some common problems. And again, as an occupational therapist, these are some of the common problems I see across the homes that I go into. And then some questions that I want you to jot down and ask yourself. And then after, I'll give some recommendations for each of those spaces as well. So let's start with the kitchen. So common problems in the kitchen can include forgetting to turn the stove off, carrying multiple items, and using a stool to reach high. And I want to highlight using or carrying multiple items and trying to multitask. So a lot of times, especially when you're transferring food, for example, from the kitchen to a dining room, you will carry a plate in one hand and a water glass in the other. So if you were to trip and fall, your hands already have something in them. And usually your reaction is to catch yourself with your hands if you were to fall. So just thinking about making more trips, using a basket, or some type of rolling cart to take things from one space to another in your home environment can free up your hands so that if you were to fall, you would hopefully catch yourself with your hands versus hitting your head. So some questions I want you to ask yourself include, are you able to reach high shelves or cabinets without using a chair or a stool? Can you easily transfer that food from the kitchen to whatever table you're using for meals? And can you walk around without bumping into anything? So related to those questions, some of the general recommendations people giving home assessments like to make include thinking about keeping the most used items at waist level, so you don't have to use a chair or stool to get to things. Never use a chair as a stool. Use a wheeled cart, as I mentioned earlier, or attach a tray if you're using a walker, or a basket to the walker to help you carry things or transfer things from one space to another. And then I always like to point out too, it's always good to check expiration dates, not only of medications, but of your food, both in cabinets and within the fridge, because it's important to get rid of some of those things so that it prevents you from getting sick. So maybe start a new habit, and once a month you go through your fridge or your cabinets and get rid of things with expiration dates that have expired. So moving to the bedroom. So some common problems in this space include having a bed that rolls, is either too high or too low for you to safely get out, inadequate lighting, and not having a phone or a flashlight near the bed. So questions to ask yourself: does your bed remain stationary when you get in and out of it? Can you easily get in and out of it at its current height, or is it really a struggle? Is there adequate lighting for walking, especially at night? Think about that pathway from your bedroom to your bathroom. And do you have a phone and a flashlight that can be reached from the bed in case of an emergency? So we've had lots of storms here in Wisconsin this year, so it's really important if electricity were to go out that you have a flashlight next to your bed to help you get around. So some recommendations. I always encourage people who don't have their bed against the wall to move it against the wall, so that way it's more stationary. If it has wheels and the bed is too high, you could always remove those wheels. You could also remove legs from the bed frame or get a thinner mattress if it's too high. And when you're sitting on your mattress, you want your legs to be comfortably, when you're sitting at the edge of your bed, a nice 90 degrees, and your feet flat on the floor. And then again, you want to make sure that you have some type of way to get a hold of people. So a phone, Apple Watch, whatever it is next to you, and then a flashlight as well next to your bed. So moving on to the bathroom. So common problems that occur in the bathroom include having slippery floors, use of a bathroom, using bathroom fixtures to get up and down, and again, no phone or fall alert system in place when you're in the bathroom. So questions you want to ask yourself: how easy is it to get on and off the toilet, and are you able to do so without grabbing onto that towel rack that's in front of you or a toilet paper holder that's right next to you? Can you get in and out of your bath or shower without losing your balance? Do you bring a phone or life alert button or watch with you when you go to shower or bathe in case a fall were to happen? And this is also a good space to make sure you have adequate lighting at night. So putting a nightlight in your bathroom is also really important. So again, recommendations. Over time, a lot of the floors of your bathtubs or your showers do have the little treads, but they fade over time. So getting a rubber mat that sticks securely for the inside of your shower tub, and then also getting a secure bath rug so when you step out. So think about, go go do a step test with your rug next to your bathroom. Does it easily move when you step on it? If it does, think about getting some rug grippers or something to put underneath that rug, or replacing it with a new one, as the treads may have been already worn down. Thinking about installing grab bars. So it's really common for grab bars to be placed horizontally next to a toilet. Or if you're having a hard time getting up or off the toilet, installing a safety frame that hooks to the around the toilet seat. You can also, this is more costly, but there are raised toilets now that you can have a new toilet installed that's elevated. And then also some grab bars are really common, depending on where you go, to step in, a vertical grab bar to help you step into a bathtub or into a shower. And then also it's really common to have a horizontal grab bar in the shower or bathtub as well, for you to hold on to once you get in. And then lastly, again, just making sure that, especially if you're living alone or if you're showering or bathing when no one's in your home, making sure that you have some type of fall alert system with you in the bathroom when you're doing, your morning routine or evening routines. So common problems in the living room can include, again, not having secure rugs, clutter and electrical cords in walkways or pathways. So you want to ask yourself, can you walk around without tripping on anything? Is there adequate lighting in this space? And are the rugs well anchored, or do they have non-skid surfaces? So think about setting goals for yourself. If you have clutter, thinking about what could be moved to a different space to make a clear pathway or walkway. Making sure electrical cords are taped down or tucked behind things, so again, you're not tripping over them. Removing rugs that slip or bunch. I know how important rugs can be, so there are different things that you can do to draw attention to the edges of your rug. You can mark it with bright colored tape. You can make sure that the corners are secured to the floor. So if there is a rug that you're having a hard time getting rid of, that's in the center, especially of your living room, if you have hardwood floors and your couch is on, making sure that the corners are secured. And then if there's any carpet bumps, or, thinking about when the floor is transitioning from, your living room to your kitchen. If there's a big step, or if there's like a big tread where you have to step over where your foot could catch, because as we age, we don't pick up our feet like we used to. So those are the spots where you can start to pay attention to and either mark it with bright colored tape to cue your brain to step over it, or consider replacing it so that it's more of an even threshold between the different floor changes. Moving on to the dining room. So the most common problems here are, again, clutter and poor seating. So you want to ask yourself, can you easily get in and out of chairs? And can you, again, walk around this room without tripping or bumping into anything? And to be more proactive, if you're not using a walker now, if you were to need a walker, think about how much space you would need to get around your house with a walker. So moving big furniture pieces so that you could move safely. So again, remove clutter. I have the last few home safety assessments I've done, I've noticed quite a few dining rooms do not have or have chairs without armrests, which can make it more difficult to get in and out of when you go to sit down. So thinking about replacing any of your chairs with higher ones with arms. And then if you have chairs that have wheels, just trying to get rid of them, especially if you have flooring that's more laminate flooring or vinyl or wood flooring, because those chairs can get out from underneath you when you go to sit or stand up. moving on to the garage. So some common problems here include inadequate lighting, not having handrails going from your house to your garage with the steps, and then uneven or slippery steps and flooring. So again, here you want to think about, can you reach everything without using a stool or a ladder? Are steps going in to your garage or out of your garage in good repair? And can you walk around again without tripping on anything? So remove clutter from walkways, install handrails, and add additional steps. And then relocate items, especially those that are up high that you're going to be that you would be using more frequently to lower levels in your garage. So some space recommendations, and these are the recommendations and are ADA compliant. So for doors to be wheelchair accessible, they need to be at least 32 inches wide, the opening. So if you were to need a wheelchair down the road, you could measure your door widths right now to see if they're 32 inches wide. Some people, if it's not 32 inches wide, it's because of like the door that's being hung. So you could always consider just removing the door down the road if you were to need a wheelchair without having to increase the door width. Steps should be about 4 to 7 inches in height and 11 inches in depth. And it's important to note that all your steps need to be the same height and depth. And if they're not, then it can impact your balance from when you're going to one step to another. If you do have steps going, especially wood steps, going into a garage or within your house or down to a basement, you want to make sure that you have stair treads because those can get really slippery over time. So stair treads you can get off like Amazon, Menards, Home Depot, and they secure down to each of the steps. You can also mark the edges of your stairs with bright colored tape, again, to draw attention to the need to step down or step up. And then another thing, especially for outside, thinking about like where your mailbox is, or if you have to access your outside backyard for a pet or whatever it be, making sure that you have motion activated lighting or remote control lighting to light walkways to prevent falls. I also, during all the home safety assessments I like to point out the file of life. So this is really important to have, and if you already have one, make sure it's current and updated. So emergency responders are trained to look for this file of life on, most often on fridges. You can get like a magnetic, like you see here in this image, it just sticks to the side of your fridge or to the front of your fridge. And this link will take you to a website. And a lot of agencies, maybe even WEHA, has copies of these that you can get to fill out. So that way, when an emergency responder does come in case of a fall or in case of some emergency, they look here to see, if you have any pertinent wishes, conditions, what your insurance is, contacts, etc. I also wanted to highlight, because I know a lot of people are starting to get Apple Watches because they don't like to carry around the heavier cell phones that we all have nowadays. So Apple Watch, they actually have a fall detection SOS emergency call response that you can set up within your settings, which is really great. So it detects falls and will ask you within I think you can put it up to like a minute. If you're not moving, it will cue you. And if you don't respond, it automatically calls for help. So if you don't have a life alert button or a bracelet, necklace, etc., your Apple Watch may be one thing you want to check out for the settings to help you prepare for an emergency. So I also just wanted to share some resources. to help you think about all of the recommendations and putting them in place. So Age Better Inc. is a nonprofit organization here in Dane County, and they offer free home safety assessments to people 60 years or older in Dane County. You can also reach out to your area agency on aging and aging and disability resource centers. So if you know, just based on the presentation today, that you want a grab bar next to, a toilet, your area agency on aging and disability resource centers, they do have adaptive equipment resources available for those who qualify. There's also some, again, like different types of contractors who focus on helping people age in place and making modifications and getting adaptive equipment. So one of them is Adaptive Remodeling Solutions, and then Project Home. And I'm also a big fan of the National Council on Aging. They have a lot of resources and briefs and how-to guides and videos related to home safety and fall prevention that we have probably already helped share out too. So in summary, I want you all to remember that simple modifications, such as the ones that I described today, to your home environment can facilitate successful aging in place, and that there are a variety of existing resources to really help you fulfill the responsibilities and create an enabling environment. So that is all I had for today. I'm happy to answer any questions related to your home or home safety recommendations that I shared during the presentation.
Awesome. Thank you so much, Dr. Fields. I don't see any questions currently in the chat. I do see someone has raised their hand. So BJ, if you have a question, feel free to come off of mute.
Hi, my name is BJ Arments, and I am in Wauwatosa. Wauwatosa is one of the few municipalities that actually has a commission on aging for the city, and also a commission for people with disabilities. And we each support, we've lobbied, and Wauwatosa now has hired a special manager along with funding a program so seniors who are living in their homes are able and want to age in place. You can apply for a loan or a grant to update your home with accessible features. And if you stay in your home for 5 years, that loan is forgivable. So there may be things that your city has to offer or that you could find out about. The other thing I would like to mention is that a key factor in preventing falls is to get your hearing checked, because untreated hearing loss increases your risk of falling by 30%, 30. And all you have to do is at least get it checked out, find out if there is an issue, and you can improve your odds to not fall. Thank you.
Thanks, BJ. That's a wonderful resource, and I'm glad that that's available. The loans are available. And yes, I totally agree. Making sure your vision and hearing, you go schedule those healthcare appointments to stay on top of it and get those things addressed if changes are happening for you.
And to see some comments in the chat just around some of the topics that you're covering related to bending down too far, looking for expired products and covers. I already found some people did during the presentation. Some conversation about stepping on as well, and I'll talk a little bit more about that. Anyone else have any questions?
I always do encourage people to, it can be overwhelming to think about all of the changes that you maybe have to make to your home environment to really prevent falls and increase the accessibility. So set goals for yourself. Tackle one room, each month, and think about, if there's clutter in there that's in the walkways, like what can you donate? What can you give to family members or friends? Don't try to do it all at once because it can be overwhelming. And like BJ said, take advantage of those state level resources and county level resources, because it really is a desire. I think the latest AARP report said that, over 95% of people want to age in place. And in the long run, it will save you and your family a tremendous amount of money to do so. So even if you think about, the costs associated with adding in steps or railings or grab bars, like I said, tackle one thing at a time, so that it's more financially doable and also emotionally doable.
Yeah, great point. I do see a question that came into the chat. Are senior housing places obliged to provide safety bars in the shower?
So I guess I'd have to know a little bit more about the senior housing. So the private sector, for housing, it's not required that places follow ADA standards. So a lot of people, for example, will build homes and inspector will go through, and if your door width isn't 32 inches, it's not going to be like written up, for example. But those that are like public, for profit, they are like most senior housing, I would say, are required to follow ADA standards.
Another question about grab bars in the chat. How long of grab bars? I bought a 24-inch, but should I get a couple of 12-inch ones too?
The length really depends on where you're wanting to put the grab bars and the purpose of the grab bars. So if it's going next to, I guess I'd have to see the space. So I'm sorry, I can't answer more directly. If it's going like in the shower, I don't know if that attendee can share a little bit more. But if it's going in the shower, you might want like a longer one. But if it's like attaching next to a toilet, a longer one might not be necessary. Yeah, BJ, I saw your hand up.
Hey, I've done some playing around with with grab bars in my bathroom, and I must admit I put it up the wrong way on an angle. Didn't work, but I said, okay, just have to move it. And even though it's holes in the wall, it's okay. It's better to have it positioned the way you need. Because I'm having a double knee replacement, and I really need that bar to be positioned well and strongly. And I also strongly advise getting the ones that screw in, not the stick-on ones. And on a different note, thank you for talking about housing. Our commission met last night, and one of the issues we have, and every city has, is that they may create senior-only housing, but they don't always create affordable and accessible housing. And it's been looking very challenging, but there are some lawsuits in various parts of the country that may help us change that, because developers are being challenged because they're accepting some tax breaks from municipalities, and they are not putting in any ADA aids or even the most basic type of assistance, and they're not putting in affordable housing. And it's something that I ask that you consider looking at in your city and your county, that if they are building apartments or whatever, and if they are getting any money from the city, that they should be required to have at least some affordable and accessible units.
Yes, thank you. Those are great points, BJ. And I'm gonna put in the chat, a link to, the U.S. Department of Housing and Urban Development. And the Section 504 of the Rehab Act that is all about, you know, the fair housing and accessibility standards for you all to peruse at your leisure. But I always say, you know, if you're in a senior housing facility, ask. Like, you have to put in the request and ask. Because they're not gonna make the change unless you express a need.
I was gonna put in the same plug, even if you're renting an apartment or a home, always talk to your landlord and see if there's those changes that you can make. There is a comment in the chat, and I think BJ, you mentioned this too, about not using those suction grab bars because those aren't for weight bearing. So even if you do have to make changes, get those professionally installed. If you are renting, again, just talk with your landlord about doing that for your safety.
Yeah, and the suction grab bars, I mean, the products are getting better with time. Some of them have markers, like it will indicate if it's like a secure suck to the wall by like a color. And it will say how much weight can be used with each of those suction grab bars. So really, if you are going to use those, really pay attention to those details before purchasing. And I'll just put like an example of one in the chat, just so you can see what we're talking about.
I see one more person, Kathy, with their hand raised, and maybe we'll take that one last question or comment before we move on. Kathy, do you want to come off of mute?
Thank you. This is Kathy. I work at Luther Manor Terrace, which is an independent facility for seniors in Wauwatosa. So hi, BJ. And we do have very accessible apartments. Our showers, for example, in many of our apartments are zero access, meaning there's no lip at all. Others have a smaller lip, but they all are equipped with a complete series of grab bars. There's grab bars by our toilets. We will rapidly install. Anybody needs a toilet seat riser. We have high toilets already, but if they need that, we'll install that. We will do whatever is necessary. And we really encourage people to have help buttons as well in their units. They have emergency pull cords, but wearing that remote emergency help button is really an extra great step, that if there is a fall, help can be gotten immediately. Thanks for letting me share in this. I appreciate it. I'm sorry my video is not working for some reason today. I apologize.
No problem. Thank you so
Kathy.
much.
Suzanne, can I just share my screen? Because I just want to share some placement. I should have probably put this in the presentation, so my apologies. And I'm happy to share my slides if anyone's interested for those links. But let me just share. So this good old Wayfair, can everyone see the
Yep.
picture? Okay, yeah. So this is probably the more common spot to put grab bars, especially if you have a tub, is if you're entering this way. And then horizontally somewhere, depending, it's going to depend on like if you're sitting, if you're standing, how high up or how low you place them. But this is generally where you would put a vertical one and where you'd want like a horizontal one. And you want a horizontal one placed. So like maybe right now you're standing, but down the road, you might need a bath bench that sits in your tub so that you can sit if balance becomes progressively worse. So thinking about, you know, could the grab bar be easily accessible sitting and standing? And then I also mentioned safety frames. So if you aren't able to put in grab bars, because some people can't, just based on the layout of their bathroom, you can get safety frames. I personally like the ones like this, where it attaches to the toilet on the back. And then it has the rug grippers on, or the floor grippers on the bottom. Those are probably the best alternative solution if you can't do some type of grab bar in your space.
Awesome. Thank you for sharing all of that. And thank you everyone for dropping different resources in the chat and all of the great discussion. I did before we wrap up for the day, I want to share what we have going on at the statewide level. So again, I work for the Wisconsin Institute for Healthy Aging, the organization that is coordinating this webinar today, but then I also coordinate the statewide Falls Through Wisconsin Coalition. So just wanted to share some resources in addition to all of the great resources that Dr. Fields shared today. And again, just kind of painting that picture. I know we talked a little bit about some of the data at the beginning of the webinar, but nationally, more than 1 in 4 older adults falls each year. If you have fallen, you are definitely not alone. I'm sure most of you have known someone that has fallen. In Wisconsin in 2022, so just over a couple of years ago, over 47,000 older adults, and older adults meaning those 65 plus, went to the emergency department for a fall. And again, in that same year, emergency medical services, or EMS, in Wisconsin responded to over 130,000 falls. And the number of falls that EMS responds to are increasing by nearly 10,000 a year statewide. So as we know, the population is aging. Falls are common as we get older, but there are many, many things that we can do to prevent falls, including things like looking at what is in your home. I wanted to share our website. If you haven't seen this before, this is a great tool, great resource in addition to the things that were shared today at fallsfreewi.org. Anyone can go here. We have tons of great information. There's some videos, there's stories on here. We have lots of great information, articles about falls prevention, but I wanted to highlight a few things here. So if you go to this Prevent Falls page, we have resources on, you can learn your falls risk, so take a falls risk assessment, read stories from people throughout Wisconsin that have fallen, what do you do if you do fall, finding a falls program, we'll talk about that in a little bit too. And then just highlighting a few of these here. So we're talking a lot about assistive devices today. Someone mentioned hearing, so checking your hearing, vision, medications, footwear, balance and strength. All of those things can impact your risk of falling. So again, just going into some of these here so you can see what sort of things we have available on our website. Like the picture that Dr. Fields had shared, we have some pictures here about maybe where you might want to install some grab bars. In addition to grab bars, and what other things you can do, what other resources you can have, handrails, canes, and walkers, all of those great information talking about medical alert devices, different things like that. So definitely welcome you to kind of peruse the website and learn more about each of these different topics here. But then since we are talking about home safety today, I also wanted to highlight our home safety challenge. So that's right here at the top. If you click on that, this landing page here just goes into some instructions about how to go through our home safety challenge and what to all look for. But I'll click on this so you can kind of see what it looks like if you're interested. After today's webinar and going into more detail in your home, I know Dr. Fields talked about what to look for in each room. This kind of gives you a picture of doing that. So what you'll do is you'll go on your laptop, tablet, whatever it might be, and you'll click your kind of cursor around. It may be a little delayed on your end with my internet, but you can kind of see some things are popping up and changing colors. So what you're looking for here are some different things that may be a hazard in your home. And when you find something, you'll click on it and this pop-up will come up and it'll tell you what the hazard is and maybe what you can do about it. And then some different tips as well. So this home here currently does not have railings. So a railing being installed on both sides would be a great addition for safety for home. Talked about lighting a little bit, again, adding that home safety piece. And you can go in at this entire home. This is a real Wisconsin home that we staged with some fall hazards and some tips. You can go up to the bedroom and see different things that may cause a fall in the bedroom. We talked about, bed height, having good footwear, cords along the floor. You can go into the bathroom and see some different tips here. So again, you're really just kind of going throughout this entire home, finding different tips and finding things that may be fall hazards here. And you can see here, There's 58 total things to find throughout this interactive home safety challenge. If you're having an issue in one of the spots of finding all of the items, you can click this show hints. And you'll see here that these arrows will kind of show you what things you're looking for. You can show everything that's been hidden in a certain room as well. And if you're just looking for a little bit more, you can also download our home safety checklist. So this goes into, again, all areas in the home, the back and front entrances and outside, living room. And again, just gives a little bit more detail about some certain things that you can look for to improve the safety of your home. Lots of great resources here on the Wisconsin website with our home safety challenge. And then also the great information under this prevent falls section as well. I know I saw in the chat, someone dropped some information about some events in the Milwaukee County area. As you may know, September is Falls Prevention Awareness Month. So currently there are a lot of local events happening throughout the state. And you can see that here, again, this link is on our homepage. There's some great events happening throughout the state: Green Bay, Jefferson, Stevens Point, Balsam Lake. There's screenings, there's open house events, resource fairs, lots of really great events happening. If you're looking for some more information, maybe you want to go and have a balance and strength screening. Some of these events are offering hearing screenings as well. And again, just being able to be connected with some great local resources. So definitely check that out if you're interested in learning more. And then I also wanted to share, since there was some conversation about Stepping On program in the chat as well. So the Wisconsin Institute for Healthy Aging is the disseminator of the Stepping On Falls Prevention Program. And Stepping On, it's a 7-week workshop, and it's evidence-based to reduce falls by 31%. So if you're interested in finding a workshop near you, you can go to our website. And again, I'll share the links for these after this webinar. So you can go to our website, wihealthyaging.org, click on programs and workshops, find a workshop. And if you scroll down here, you'll see this map of all of the great healthy aging workshops that we have throughout the state, but specifically Stepping On. You click here to see schedule. You can see here we have tons and tons of great workshops coming out all throughout the state. There's a couple of virtual ones that are coming up that you can join. And again, there's some that are happening all throughout the state. There's lots happening with Falls Prevention Awareness Month, as you can see. So lots of workshops starting this fall, and some scheduled out through this winter as well. So again, that's a 7-week workshop, evidence-based to reduce falls by 31%. And one of the main topics in the Stepping On program is home safety. So there's a whole workshop session dedicated to home safety. The participants of the Stepping On program practice balance and strength exercises, talk about vision and medications, and have a number of guest experts that come in to provide some additional information. So again, that's at our website, wihealthyaging.org. And then also have our fallsfreewisconsin.org websites. So I just wanted to highlight those different resources as well, and allow some more time for some questions and answers. So I'm just going to check the chat.
May I just do a quick testimonial for Stepping On? Because
Yeah.
when I saw that it was 7 weeks, I thought, what are you going to teach me in 7 weeks? A lot. And it's only 2 hours a week, but it is, every minute is valuable, and it helps us to remember from week to week. And it is all evidence-based. So I can tell you it made a big difference. And one of the things they stress is our raising our awareness, focusing on what we're doing. If you're not averse to the term, mindfulness, basically to focus on what you are doing right now. I'm going to the basement to do laundry. Hold on to the stair rail, walk carefully, look for obstacles. And it's an amazing workshop. So I highly recommend it.
How are you?
Good, how are
Do
you?
you feel ability for 24
I
hours?
see a few other
Okay,
comments.
I might have a
for-
family.
And okay, there we go. Yeah, another comment about stepping on, still using the things that you learned in the program. So that's great to hear. It really is a valuable program to learn not only about home safety, but also balance and strength. And again, like BJ said, just taking those things into your everyday awareness as you're kind of walking throughout your home and your community as well. Wanted to offer a couple more minutes for questions and answers. If anyone has any questions about Fall 3 Wisconsin or the Wisconsin Institute for Healthy Aging and our Stepping On program. I see Beth, you just shared the resource of Falling Safely, AARP, so that's great. And again, we'll share all of these resources out after the webinar.
I do think if you're in an area and you can't find like a nonprofit like Age Better who serves Dane County for free home assessments depending on your age, it is worth talking to your primary care provider and seeing if an order can be placed for you know, an occupational therapist. Most, again, home health, like you have to be considered homebound and have to have had some injury or condition for those services to come into your home. But proactive, I think it's always worth asking the questions during your next healthcare appointment, because there may be opportunities to get those services if they're not available in your community through your healthcare system.
Yeah, that's a great point. Definitely having this conversation about falls prevention before you need to with your primary care provider.
And I shared my email and my work phone in the chat. And again, Susan will send out the information, but feel free to email or call if you have specific questions related to a space within your environment and aren't in the Dane County area.
Awesome. Well, thank you, Dr. Fields, for all of the great information you shared. I hope this webinar was super helpful for you all. We'd love to hear some feedback from everyone that was in attendance. I believe Erin will be dropping the link for our evaluation for this webinar in the chat. If you share your thoughts, it's a very, very short evaluation. You'll be entered to win a t-shirt, which is seen on the screen for Aging Well. So happy to hear any feedback that you have about this presentation. And next up for our Age Well series, as this webinar is part of WeHa's Age Well series in October, we will be doing a presentation about nutrition. And then in November, we'll have information coming soon, but that topic will be about the building blocks of connection, so related to social connection and social isolation and loneliness. So if there's any last minute questions, happy to field those now, but otherwise, thank you all so much for joining the Wisconsin Institute for Healthy Aging for the Age with Confidence at Home webinar with Dr. Fields. Again, thank you, Dr. Fields, for your time and knowledge during today's presentation. And like we said, we'll be sending out a copy of the slides as well as the recording from today to those that registered for the webinar. Thanks, everyone.
Thanks. Have a great rest of your week. Take care.